Press.
Good morning, everyone, and welcome to our January 2023, our first edition of the year for our Teaching Tuesdays. We are doing financial wellness, getting your house in order. And my name is Bonnie Norris, and I'm one of the district managers with the Association Member Benefits Advisors. And also joining me today is Jim Kane, the other district manager here in Ohio. And we have a special guest today, Greg Bennett, who is your legislative lobbyist. So Greg, we want to welcome you. This is great that we were able to get you today. Gary is actually working with our Canton group today with their new president. So we wish them all the best of luck and are so fortunate that we had someone step up to lead that group. So today, as we get started, just to do a couple housekeeping things, we will be in listen only mode today. So we do ask that if you have questions to either put those in chat or the Q&A, and we will be giving you a lot of tips and things to think about, really arming you with knowledge on maybe some things that you need to start asking questions about. So we do encourage you that you have a pencil and paper there that you can take a lot of good notes or write down any questions that you have. And then we are recording the program today, and I'll get that over to Missy so she can get that posted onto the PFRO website also. And today, as we go throughout the day, you'll see there in the top corner is the little QR code that if you do want to sit down with either Jim Kane or myself to really, talk about your needs specific or personal needs, go ahead and get your camera out, put it on the camera mode, your phone out, put it on the camera mode, hover over that QR code, and you can put your information in there, and either Jim or myself, just one of the two of us, will be contacting you so that we can make sure that we answer your questions. But again, we're so excited that our folks are here today. We started this, our Teaching Tuesdays, it's been almost a year. Each month we do a different topic, and we thought that, since New Year, New You, we would start with financial wellness and some of the things that you can do to help get yourself organized. Now, this program today has some of our highest registration that we've had in the last year. So I do want to take the opportunity just to explain a couple of things. First of all, I don't always sound like Rudolph the Red-Nosed Reindeer. I'm a little plugged up today, and I'm hoping it's not COVID. I'm hoping it's just a sinus infection. So that tells you the state that we're in when you hope for a sinus infection. But just so you folks understand, AMBA, Association Member Benefits Advisors, is actually has been around for over 40 years, helping our retirees groups, and now we're up to over 80 different retirees associations where we actually help pull together over 17 million members and potential members. And here in Ohio, we're so privileged to be endorsed by the Police and Fire Retirees of Ohio, but also the Retired Teachers Association, the School Employee Retirees, and the Public Employee Retirees. And many times what we do is we help folks find solutions to problems. And a lot of times it's just providing information, because we never want one of our retirees to say, oh my gosh, I wish I would have known that. And we sure don't want you spending money that you don't have to. So that's why through the benefits review process, we can help folks better understand what your association is doing for you. Like I said, my name's Bonnie Norris. I'm here in Southwest Ohio. Jim Kane and I split the state, but I'm located in Oxford. So if anyone's heard of Miami University, it's about 10 minutes from here. And I've been with AMBA for about 8 years. And Jim, tell us a little bit about yourself.
Good morning, everyone. I've been with AMBA about 10 years. The easiest way for people to understand who we are is Association Member Benefit Advisors. The AM is you guys, Association Member. Bonnie and I are the BA, the Benefit Advisors. So again, my background prior to serving Ohio's retirees, I ran nursing homes, home health agencies. I've been in the Medicare space for about 32 years, so there's very little between us. Bonnie and I won't be able to answer. Even if you have a one-off question, it's not specific to what we're going to discuss today. Today, you just need assistance. Please feel free to reach out to us. You can get us via email, or we'll also provide our phone numbers for those that prefer the phone.
That's great. And so this is the portion of our program where we always have an update from our association. It's usually, Gary is with us. But one of the big things, Greg, before I flip it to you, the big exciting news, especially if Missy's out here, PFRO is going to have an office again, and it's actually only about 4 doors down from the old office. So that is going to be the new address there, 7510 Slate Ridge Boulevard. Missy says she can still park under the same tree that she used to, and just go down, four doors down the other way. So I'm super excited. They'll be moving into the new offices either like the last week of January or the beginning of February. So there may be an interruption in services, just slightly as they get everything moved into the new building. So with that, Greg, I heard you speak at the annual meeting back in the fall, and just did a tremendous job explaining everything that you're involved in with PFRO and their legislative issues. So I'm going to turn it over to you so you can give us an update on maybe things like the windfall elimination and the other things that's going on in the crazy state of politics.
You got it. Thanks, Bonnie. Thanks, Jim. I appreciate the time, and hopefully everyone can hear me all right. Greg Bennett with Byersman and Associates, a partner at the firm here. I've been with the firm for over a decade at this point, and previously came out of the Ohio State House, working for the Ohio Senate for about half a decade. So 15 years total here in Columbus, Ohio. Our firm is located right across the street from the State House, and of course, it's an honor and a pleasure to represent all of the members of the police and fire retirees of Ohio at specifically the state government, but also doing a little bit of federal stuff as well, which we'll get into here. So I just wanted to give a brief overview of the state of politics in Ohio and frankly across the board. Starting with the state level specifics first. So, as the Ohio legislature closed out the 134th Ohio General Assembly at the end of this last year with a bevy of lame duck activity, we can now take a closer look at our advocacy efforts over the last year, 2 years, and what's ahead for Ohio politics and policy. At the end in December there, elected officials addressed several high-profile issues, including pandemic recovery funding, for local governments and nonprofits and businesses, state legislative and congressional redistricting, criminal justice reform, legalized sports betting, and election procedure changes. Given all of these public policy changes over the last 2 years, Governor DeWine and Ohio lawmakers still have much left that they would like to accomplish. So I want to take the couple minutes here and talk about a few notable updates relevant to PFRO and our members. First, ESG and fiduciary responsibility. So in response to a national effort to curb investments and investment decisions, I should say, through a lens of environmental, social, and governance policies, ESG for short, we saw the introduction in Ohio of legislation to address these public investments and the fiduciary responsibility in relation to ESG policies. So Ohio Senator Kirk Schuring proposed a bill last year to clarify existing law in Ohio that retirement and investment boards can consider no strategy other than that of maximizing investment returns for Ohio public employee investments. Specifically, the legislation directs board members of the state's public pension systems, higher education institutions, and Ohio's BWC system not to make any sort of investment decision with the primary purpose of influencing any social or environmental policy or attempting to influence the governance of any corporation. While this legislation did not pass last year because it was introduced very late in the General Assembly, we expect this bill to, and frankly, it just did last week to be reintroduced, but we expect it to move forward in the process and likely get passed into law before the end of the next 2 years. Another bill, a state legislative bill that we've been focusing on for PFRO and closely monitored and engaged on was the Police and Fire Pension Fund effort to increase the employer contribution rates by being phased in over several years. Opponents of this legislation identified significant costs to Ohio's local governments, coming in around $117 million annually for that increase in the employer contribution rates for both the police side and the fire side. This legislation last year did receive several hearings in both the Ohio Retirement Study Council and the House Insurance Committee, but ultimately failed to pass before the end of the General Assembly. We are waiting to see if the sponsors will reintroduce the bill in the same form or some compromise effort to try to appease or work with the opponents of the legislation. But we still wait to find out more information about that. And of course, if and when that bill gets reintroduced, we will continue to engage on it and try to get it across the finish line in some way, shape, or form. And then as Bonnie had mentioned, I wanted to touch on the federal windfall elimination provision and government pension offset reform effort. So on that federal front, Congress will continue to review the broader Social Security system heading into this new Congress and proposals to modify the WEP and GPO. There was hope last year that Congress would find a solution to the WEP and GPO issue as lawmakers negotiated a year-end omnibus spending package, that $1.7 trillion package passed and signed by the Biden administration. But overall, the complexity of the WEP and GPO issue and the impact on the broader Social Security system has forced these efforts to continue into this new year and this new Congress. I will say there are a few silver linings here. I know many of you have been watching this for perhaps the last 4 decades, trying to fix these provisions under federal law. The silver linings being that after the more than 40 years of advocacy efforts to change this law, Congress has reached a high watermark of more than 300 co-sponsors heading into the end of last year on the WEP and GPO full repeal bill. Congressional leaders also committed to identifying a compromise solution, and we will continue our outreach to Ohio's congressional delegation to ensure that this issue comes to fruition, whether it be a full repeal or a modified formula to help those impacted by the WEP and GPO and getting less of their benefits than were rightfully earned over their time. So that's positive there. And then we also had an Ohio representative and chairman of the Ohio Retirement Study Council, Phil Plummer, introduce HCR, House Concurrent Resolution 52. Essentially, this is a resolution urging Congress to repeal to give those that pay into that Social Security their full benefits upon retirement. So with that, those are the legislative efforts. We've got new House leadership, a speakership shakeup that is coming into more light and figuring out who the leadership teams are. But we have a lot ahead in the Ohio General Assembly over the next 2 years, including the introduction of Ohio's main operating budget, the largest piece of public policy. It's not just an appropriations bill. So we'll want to be vigilant and keep an eye out for both positive public policy efforts and potentially negative public policy unintended consequences from policies getting introduced in the budget over the next 6 months. And that budget needs to be signed into law in Ohio by July 1st of this year. So a very quick 6 months, an introduction in mid-February. So Bonnie, Jim, with that, thank you. I'm happy to answer any questions. And again, it's a pleasure representing PFRO.
And Greg, you actually do have our first question. Someone wanted to know, what does GPO stand for?
The government pension offset. So it's similar to the WEP, but it applies to spouses and widowers of retirees and those that are impacted by the windfall elimination provision of having worked, both contributed to their pensions and Social Security.
Okay, thank you so much. And thanks for taking time today, Greg. I appreciate that.
Sure.
So
thank you.
Okay, so folks, as we get started today, what Greg shared, really shows the power of your association, and how many times when Jim and I sit down with somebody and they want to know, what does the association do for me? We thought we'd take just a moment and sort of explain. So Greg, he is the person that's in there in the trenches, really watching your back and protecting your pension in the hallways of the legislature. But then in addition to what the association does, they also help to preserve your health benefits and then also connects those retirees to local communities through local chapters. And again, that's where Gary's at today, is helping the folks up at Canton get reestablished there. And then finally, the association can help offer those exclusive benefits and discounts to you. And really that's where Jim and myself and all the folks here at AMBA come in, because, you know, as we work with over 80 different associations, obviously there are problems that affect our retirees, and we go out and help find those solutions, and then make sure that you folks are aware of, you know, what is available to you. Now, as we look at, you know, all of the different benefits that are offered to our retirees, many times, you know, they fill gaps that maybe aren't covered by the benefits you have. Maybe when you retired, you lost your dental and vision. Perhaps you've moved out of state, and, you know, for whatever reason, you weren't able to port or take those benefits with you. Many folks don't realize or understand that you can actually extend those benefits to your parents or to your family members, you know, that maybe weren't eligible for the same types of benefits that you have. Now, through AMBA and PFRO, you have a vehicle to make sure you can take care of your family members also. And then finally, you know, so many of us are in that sandwich generation where we're taking care of kids or grandkids, but also those elderly parents who are, you know, starting to need more and more assistance at home or even in long-term care facilities. So, you know, the benefits can actually prevent you or a loved one from having to take early retirement, which again, you know, when you do that, that compounds your losses. There's actually one study, ladies, that says that when we take early retirement to care for an elderly or ailing family member, it actually impacts us in approximately $364,000. So again, you know, your association has done things to come up with ways to make sure that our retirees are not spending money that you don't have to, that you can maximize and save. So Jim, you know, maybe take a moment and just tell us, what are we doing here today? What kind of things are we going to talk about today?
We've got a couple of objectives. First of all, talk about the Medicare changes and how to be a smart healthcare consumer going into 2023. Fortunately, a couple of the Medicare changes are positive, but there's some others, you know, that are gaps we want to make sure you're aware of. Talk about the windfall elimination, which which we appreciate Greg helping. Social Security changes. You know, talk about the financial tips that you can act on immediately to put some more money in your pocket. Talk about RMDs and changes for 2023, 2024, 25. A lot of people have questions about RMDs and they can be confusing. And then also, Bonnie's going to wrap up with the latest discounts and a lot of, you know, benefits a lot of our retirees don't know they're eligible for until they see the list.
So Jim, what's going on with Medicare?
Yeah, like I said, 2023 is full of good news with regard to the cost of Medicare. In 2023, Social Security is giving those that receive Social Security an 8.7% cost of living adjustment. That's an average of about $140 per month per retiree, if you will. Medicare Part B payments are decreasing by $5.20. Right now, everybody's paying $170.10 a month. In 2023, it's dropping $164.90. I will tell you, this is the first time in my career, having had done this 32 plus years, that we have had positive, financial impact on retirees in both cost of living increases and Part B adjustments. Typically one goes up, the other one goes down, or vice versa. Now, understand that if you have another $1,500, $2,000 coming in, there are some people that may impact your tax bracket. So make sure you talk to your tax professional and understand that, hey, if I'm getting an 8.7% increase in my Social Security, how's that going to impact? And what can I do to mitigate that risk if it does put me into something, category I'm not used to being in? And then again, the Part B deductible, not a huge deal, but right now it's in 2022, it was $233. For those on Medicare supplements, your Part B deductible is dropping annually to $226. All right, so Medicare reminders. Again, 2023 updates, there are over 30 preventative screening services that are now covered under Medicare. First of all, that little blue square on the right-hand side, you can see You can create a free account by going online and creating one at medicare.gov by putting in your information, your zip code, and it'll tell you a lot of what you're eligible for. Vaccines that weren't, priorly, covered by Medicare. Part D participants that are on Medicare supplements now have additional vaccines, including the COVID, shingles. There's no out-of-pocket costs whatsoever. And another big one for our members that are insulin-dependent diabetic, whether you're type 1 or type 2, insulin was a catastrophic out-of-pocket cost for our insulin-dependent diabetics. I had retirees that were paying $1,200, $1,400, $1,600 a month. It was devastating their quality of life just to be able to purchase their insulin. In 2023, insulin for Medicare recipients will be capped at $35 a month. Now, if you are 58 to 64 and you're a recent retiree and you're not on Medicare yet, if you're on insulin, you're still going to be paying the retail rate or whatever you're getting through your major medical drug program. But understand, the minute you hit Medicare, or those that are already on, you should see a huge drop in insulin costs because it will be capped at $35 a month, which is brilliant. And then finally, just a little side note, there's about 83 million retirees that are on Medicare. About 0.03% of them, there was about 250,000 of retired Medicare beneficiaries that were involved in the data breach. Those folks, and we don't know who they were, that's proprietary, but if you by chance fall into that 0.03% category, that 250,000, you may get a new Medicare card in the next 30, 60 days, and it's going to have a new number, but it'll have the same Part A and Part B date on. If you have any questions, feel free to reach out to Bonnie and I to confirm, but it's likely you are one of those individuals. Again, small percentage, but if anybody's confused by that, you may have fallen into that category. So let's talk about, our risks. Why are we talking about financial security and health in January? Unfortunately, we are going into 2023, which followed 7 years of major Medicare cuts. There were another set of cuts that were actually scheduled for 2022 to 2028, I believe, but they have since been put on hold because of what's going on with Congress. But unfortunately, there are more cuts ahead of us. The last cut was $716 billion from Medicare. And those of you that attended last year's Medicare 101, which we'll be doing in February, is the next Teaching Tuesday webinar, you've seen this slide. But they have cut $716 billion from Medicare. And people say, well, why? What was in 2013? Well, two major events. Number one, baby boomers started turning 65. And the impact of the baby boomers on Medicare has been catastrophic, financially. Secondly, it was also the year the Affordable Care Act went into place. So we have seen cuts in hospital services of 260, and these are already there, $260 billion. A lot of members, we want to make sure you're aware of something called observation days. And that is if you go into a hospital, you have to have 3 midnights as an inpatient to qualify for Medicare days, which would mean, home health, assisted living, no assisted living, nursing home care. If they put you in observation and you are not an admitted patient for 3 midnights, you really relinquish your Medicare benefit and your 100% private pay. So even though your Medicare benefit's limited, we want you to understand how critical it is that you understand observation days, get admitted those 3 nights. And again, that's something Bonnie and I can help you understand if you ever need to navigate that space, whether it's anticipating it for your future or you're currently dealing with a family member. Payment rates for Medicare Advantage plans. That's not our bailiwick, but several of our members are on Advantage plans. Medicare provisions. The big ones that we focus on are really the bottom 3. And those are, gosh forbid, you need home health, nursing home, or that other services are things like medical transport. These have all been cut significantly in these 2013 to 2022 Medicare cuts. And it's important you understand where Medicare starts, stops, and where you're left holding the bag. And that's really why we encourage our members to do a review so you understand where you start and stop.
That's
Thanks,
right, Jim. And this stuff changes, so much, and a lot of times without notice. You were talking about the 3-day stay. Actually, due to COVID, on December 21st, they actually are waiving that now because of the high rates of COVID, but that could change at any time. So, what Jim's talking about is the standard, but folks, these things do change. So it's always good to know, what the general rules are and what the playing field is. So good job with that. So one of the things that before we get to the windfall elimination, I wanted to talk just a little bit about, that cost of Medicare. If you have had a life-changing event, and maybe you got your Medicare notice saying that they were going to increase your rates, maybe even into the next income bracket, there is a way that you can file an appeal for that. And it's called the SSA 44. It's the Medicare income related monthly adjustment amount. And this applies if you have gotten married or divorced, or maybe your spouse passed away. Perhaps you stopped working or had, a reduction in hours. And maybe you lost a money-making property because of a disaster. Maybe you had a rental house that, was taken by a tornado. And, perhaps your pension stopped or was decreased for some reason. So you can actually go on to the Social Security website, just type in SSA 44, find this form, and you can, file this at this point. You don't have to wait till tax season or anything like that. You can be proactive on that. Jim and I have helped, folks do that, find that form and start that. So just remember that, there is a way, if you have had a life-changing event, you can have the government reconsider the cost of your Medicare. And then Greg, fortunately, gave us a little bit about the windfall elimination provision and the fight that's going on there. I'd forgotten it's been 4 decades that we've been scrapping over this, which is just unbelievable. But, some good insight there that, now it's getting closer, and at least the politicians have agreed to work toward a compromise. That in itself might be, a miracle, a Christmas miracle here. But just remember that with your windfall elimination, it can actually reduce your Social Security benefit by up to half of the amount of your pension. And again, this applies to Ohio retirees because you paid into the pension system instead of being paid Social Security, or being paid into the Social Security system. If you want to look at your calculator, and folks, this is extremely important for folks that are considering retirement or getting ready to retire. We want you to be aware of this so you're not blindsided, so you have a full representation of what your retirement income will be. And you can actually either contact the Social Security office, go in and sit down with them. They'll have all your figures and everything, and they'll be able to tell you what your estimated Social Security amount would be or what the reduction would be. Or you can go to the calculator. They're on the Social Security website. I've got the link right there. This is important. And when we met with all the leaders of the Ohio Retirees Associations back in December, that leadership was very emphatic that we needed to make sure that our soon-to-be retirees understood this. And about 3 or 4 years ago, I was doing a soon-to-be retired program, and there was a lady sitting there, and she literally put her head in her hands and said, "Do you mean I'm not going to get the Social Security that I paid into?" She'd had a career before coming to public service and was counting on the full Social Security. But then she, very cringily found out that no, she wasn't going to get that. So folks, if you're getting ready to retire, make sure you incorporate this piece into your calculations. And then just a couple pointers on this. Like we said, there was no real headway made, with the year-end Secure 2.0 Act. But as Greg shared, at least we're closer than maybe we were 4 decades ago. This only does impact about 3% of the Social Security recipients. And folks, that's probably why they've been scrapping over it for 40 years, is because it's not, a big enough bang there. One of the basic questions we always get is, can the windfall reduce the Social Security to 0? Well, actually, by law, Social Security can't be eliminated entirely, but it does set the maximums on the dollar amount based on the chart, and that chart is available there at the website that I gave you. And then, just remember that the maximum reduction for this year is $558. for those filing at full retirement age. So folks, if you do have questions about this, you can do the QR code or contact Jim or I. And, like I said, the best thing to do really is contact Social Security and have them give you your number. Okay. And then while we're talking about Medicare and insurance and everything, to go back a little bit, one of the things that we see, especially through open enrollment, or when we sit down to do a benefits review with one of our retirees, it soon becomes clear that sometimes folks just don't know their plan. So really, to be a good medical consumer, you really should know your plan. What are your co-pays? What amount of co-insurance do you have? What are your deductibles? What is the maximum out of pocket? And as you remember from just a couple of months ago, when JJ Walker and Joe Namath was on every other television station, they would talk about great things, but no one ever talked about maximum out of pocket. And when Jim and I sat down with people, and that's one of the questions we ask is, okay, you're on the Advantage plan, what's your maximum out of pocket? Most folks don't understand what that means or can't really tell us. So really, you need to know your plan. And some other things to think about, 5 tips to be a better healthcare consumer. If you are on an Advantage plan, what are your perks and incentives? Are you getting those? Does your coverage offer a gym membership? Well, that's great if you're actually utilizing it. Do you get like $50 a month to buy groceries or pay toward heat? If it's in your plan, you should be utilizing that. Do you understand your insurance coverage? Because those are all the bells and whistles, but the reason that you have it is to help with your medical expenses. So do you understand that? Are your doctors in network or out of network? Have you asked for pricing transparency? If your doctor tells you that you need an MRI, do you just go to the place they send you, or do you ask, well, hey, what would this cost me if I went somewhere else? I had one retiree who lived in Richmond, Indiana, and actually drove to Tip City, Ohio to get an MRI because it was going to be less expensive for them just to make that 30-minute trip. So you might want to shop around for services. And also, folks, if you do have a program that deals with in-network and out-of-network, make sure that you're always asking, are you in my network? Because Jim, sometimes when we have a biopsy or a test, that those things get sent to someone to read that, and sometimes those people aren't in our network, and then we have an issue. So just make sure that you're always asking, if you are in an Advantage plan where you do have network services, are you in my network is probably your biggest question. And then of course, don't skip on the preventative care. Jim shared with us that there's a lot of new things that are in there for preventative care with the Part D. Your shingle shots and a number of other vaccines are covered now. I had a retiree just email me this morning that was so excited she could get her shingle shot covered by the Part D. So, and then just make sure that you're always asking questions and know your plan. And with our PFRO folks, one thing that we see this time of year, of course, we just went through the open enrollment. Some of you folks may have switched Medicare supplement plans. Did you make sure that you canceled your old plan? Because sometimes what we see is, those deductions continue, and folks don't realize it until maybe 6-8 months down the road. So if you did move from one insurance carrier to another, make sure that you've canceled that old plan. And then also remember with PFRO, as long as you got either your Medicare Advantage plan, or if you're on a supplement, if you got your supplement or your drug plan, you have to have one of those through Alight. Go log into the Alight website and make sure that all of your reimbursements are set up correctly. We have seen some folks where their Part Ds from last year in January, they had switched Part Ds. They're still showing their 2022 plan through the reimbursement, but their new plan is actually on their site. So we're hoping that Alight gets that fixed going into February. So folks, just make sure that you look at your reimbursement and make sure that Alight has everything correct. So go ahead and log into this. Does that make sense, Jim?
It does. The other thing that I would share is a lot of our members don't understand or read all the literature that police and fire retirees through AMBA also has a Medicare supplement option that's oftentimes saving our members quite a bit of money from what they're on now. So if you didn't switch during your annual election period, or you're on a Medicare supplement right now, Plan N, Plan F, Plan G, any of those, you don't have to wait until next year's annual election period. You can reach out to myself, Bonnie, scan a little QR code and say, hey, am I getting the best deal? And we can affirm that you are, and or show you based on your health what else you're eligible for. And it allows our members, a little bit more of a market to shop around and take advantage of what are the best deals. It's all about saving money between inflation, between the drop in the market, which I'll talk about in a little bit here. Every penny counts. So if we can help you save a few dollars, or your spouse a few dollars, please, feel free to reach out and ask that question.
And the biggest thing, folks, with your stipend account, you do want to make sure that everything is current on that, so you are getting that money, because at this point, OPNF has, transferred those funds. You should be showing your yearly contribution for that. And then Alight will just take that off each month. So it's a good thing, to go in, log into the account, and just make sure that all of your reimbursements are set up correctly. So, and if you have questions on that or need help with that, please reach out. I help a lot of folks do that. And, like Jim said, you can scan the QR code and get in touch with us that way. And Jim, you talked about it just a second ago, but what are some of those gaps with Medicare?
Yeah, Medicare does a great job of covering, what they call eligible services. Unfortunately, eligible, the services outside of what they term eligible services are what impact us financially. So Medicare, and I want to tell you, Bonnie and I'm 55 years old. Bonnie and I being on major medical, we have the exact same risks on major medical. So if you're 59, 60, up to 64 and thinking, oh, I don't have to worry about this, we have the same risk. We just don't worry about elder care, cancer, heart, stroke, medical transport, or final expenses until we're typically, well into retirement. So understand that, Medicare, your Medicare A covers your hospitals, and it's going to cover 80% of your bills. Your Medicare B that you pay $170.10, it's dropping $5 this year. But that covers 80% of your physicians, doctors, supplies, medical equipment. And then your Medicare supplement covers the other 20%. Well, as good as Medicare is in covering 100% of what Medicare covers, eligible services, there are still 4 major gaps in Medicare where we are left holding the bag. Number one, far and away, where Bonnie and I spend 70–80% of our time, is elder care. And that is helping our members button up that risk of home health, facility care. The market's really moving toward home health. We congratulate our members that did get, traditional long-term care plans earlier in life. But the days of wanting plans that are covering 3 years in a nursing home, they're really not as popular. People are really focusing on home health care for 2 reasons. Number one, following COVID, nobody wants to be in a facility. If COVID got in, it was taking innocent residents' lives, and we weren't able to see our loved ones. Secondly, the baby boomer generation, as they continue to age, they are going to clog up every facility with Alzheimer's, dementia, Parkinson's, anything cognitive are going to get first priority. So the hearts, the strokes, the rehabs, the hips, the knees, you're going to be rehabbed at home with home physical therapists and nurses. So, understanding how the market's changed or has changed since COVID, we can kind of walk you through what your risks are. Women are 78% living into their 90s, 30% of them. Men, 74% chance you're going to use that plan. Cancer, heart, and stroke, I'm indifferent. I mean, I think cancer is very important that people look into this, especially given 50% of us will deal with it. But heart and stroke is a little bit different. Although it's a major gap, I tell our retirees when I do their review that if you have elder care, that first circle, that heart and stroke are wonderful if you want them, but they're not as critical. Because if you deal with one of those 2 major events, you already have the systems in place for somebody to come to your home and take care of you, or go to a facility with 24-hour care and rehab until you get to the point where you can hold a walker, a fork, toilet, and get back home. Medical transport. Most of our members understand about home health, facility care, cancer, heart and stroke because they dealt with a family member. Nobody calls us and says they were expecting a $5,000 to $50,000 bill for medical transport. So understand that no matter what plan you're on, Medicare is going to cover the bulk of the first trip closest hospital, no matter what your situation. If you're on an Advantage plan, you're going to pay a little bit because you've got networks and co-pays. But for the most part, that first trip won't be catastrophic. Medicare covers it. But if you have advanced life support, a secondary or tertiary transport to a trauma center or a secondary hospital, that's when you now have skin in the game. And despite being former police, fire, that your local township does take care of you locally, that's because Medicare will still cover or reimburse that first trip local hospital. But if you need to go elsewhere, that is not covered by your local township, your agreement with your friends and family. And I know I have a lot of them. I started my career as an EMTP back in 1986. We had the same agreement, but it just doesn't work if you have to come to Columbus, Toledo, Cincinnati, Akron, or Cleveland. And then final expense. A lot of people just aren't prepared when they or a loved one pass, and it's $15,000 to $20,000 to take care of final expenses, whether it's settling the estate, burial services, whatever comes up. That's always an unknown. Thanks, Bonnie. Sorry about that. That system, we click it and it's still taking a couple seconds to go on to the next one, guys.
Hey, Jim, we had a question before I go into that. We had someone ask, if I'm on a Medicare supplement, do I have to wait until October to make a change?
No. In fact, if you are on an Advantage plan, a plan that has networks, co-pays, deductible, and there's a formula out in the industry, low premiums equal high risk, higher premiums equal low risk, and Advantage plans typically have a lower premium and risk in the form of networks, co-pays, and deductibles. Where most people understand those nuances or differences, a lot of people are confused with her question. If you're on an Advantage plan, you are limited to annual election period. Some people call it open enrollment. It's actually AEP, and that's between October 15th and December 7th. But if you are indeed on, it doesn't matter what Medicare supplement, you could be on one from a light. You could, as long as you have your drug plan through them, you can leverage the your police and fire retiree option. But no, you can move. Well, can't move February 1st. It's too late already. But you can move March 1st, April 1st, June 1st. It doesn't matter. Anytime during the year, as long as you're healthy enough to qualify for the lesser price plan. And we've got a lot. I don't want to get into the weeds here. Our next seminar is going to be on Medicare 101. We'll go into all of this. But we have a lot of members out there on Plan F right now. And they think that that's the best plan because they were grandfathered in. And 3 or 4 years ago, it was the best plan. But if you're still healthy, there's an option where we can, potentially save you another $30, maybe $40, $50 a month. It's shocking the differences once we educate our members on what their options are. So Bonnie, I'll let you kind of jump in here,
Okay.
But I hope that answers your question.
No, and that's good because, that's dealing with health and then financial health, which really is what we wanted to focus on today. And obviously, expenses at the pharmacy or at the doctor's office are, can take a big chunk of our folks' pensions and just, really their nest eggs. So as we kick off into our next portion, and talk about being financially healthy, we realize that this time of year, a lot of folks make resolutions or promises to themselves, hey, I'm going to get organized, or I'm going to make sure that, I have all my ducks in a row. Maybe something's happened to you, somebody in your life has passed away and left the family in the lurch. So we wanted to spend a little bit of time today and talk about being financially healthy in 2023. And a lot of times that really comes in the form of information. So we wanted to talk about basically spending. It's good to have a budget because obviously we can't call Columbus and say, hey, I'm running a little short this month. Can you just go ahead and slip in a little extra in my pension check? We wanted to talk about how you can plan and organize. Also look at, insurance options and questions that you might, want to look at there, and insurance even beyond health insurance. And then also, how do we protect our nest egg? So as we go into this portion of the program today, let's look at the big 3 budget items. And actually, The average American spends about $37,000 per year on the three big things: housing, transportation, and food. And what we're finding now is many of our retirees are actually still in a position where they owe money on their house and still have that mortgage. So what are some ways to maybe find some hacks or to stretch those dollars? So that's what we're going to cover in this portion of today's program. So many of our retirees, if they do have still have a mortgage, with the adjustable mortgages or adjustable rates, you might want to find a good one and make sure you lock it in, or do some refinancing type thing. Some folks say, well, I'm just going to downsize, and that's fine. But, the housing market's been a little crazy. If you've missed out on that, and things are starting to come back to normal, or something toward normal. And some folks say, I'm just going to move into a condo or something like that. Make sure if you are downsizing, doing something along those lines, if you're moving into a place with an HOA fee, homeowners association, make sure that you factor that in to your monthly expenses. Maybe it's not a cost savings to actually downsize. And then we get into this idea of house hacking, which I thought was an interesting concept. But I have friends, they're actually both teachers, and they have a nice house and a pond and an outbuilding, and they actually do Airbnb for some of the more like family weekend and things like that associated with Miami University. They'll actually do an Airbnb. We've have had some retirees that have taken on a roommate. Gosh, look at Golden Girls. That's a classic example of house hacking. Those four ladies ended up together to share their expenses. And then other folks, maybe they do have outbuildings that they can, they're not using them like they used to. And there's folks that's always looking for storage. So look at the assets that you have, and then figure out, gosh, how can I maximize these? And then of course DIY home repairs, or maybe even some swapping. If you're good at electrical, but you need some drywalling done, maybe you've got a neighbor down the street that was good at that, so you can swap your DIY repairs around. And then as we look at the vehicles, since COVID hit, drive by any car lot, there's a lot of empty spaces on the new car lot, and even the little used car lots, they can't get enough of those. So do you have a vehicle at home that maybe you're not using as much, or could get by without? That would be a way to, again, use an asset, get rid of that unused vehicle and turn that into some cash. And then the other thing that we'll talk about in just a minute, maybe you're not driving as much as you used to. Maybe you lived in Springfield and used to drive into Columbus. Is there a way to look at your car insurance? And we'll talk about that in just a second, where you could maybe save some money that way. And then finally, last month we did a program on the Passport to Savings, which is available to all of our members of PFRO, where you can get discounts on meal prep and dining out. And I'll explain that here in just a little bit. So as we look at the insurance checkpoints, a few things to keep in mind. When you're thinking about your car insurance, a lot of times people say, well, when's the best time to look at my car insurance policy? I say when you're thinking about it. Others say when it's time to renew, or obviously right here at the beginning of the year. But as you examine that policy, look at the deductible. And it's just like how Jim explained the medical insurance earlier. If you can afford a higher deductible, maybe you take that out of your mattress money, you could end up actually paying less of a premium if you're able to take on a higher deductible. So look at that. Also look at liability coverage. Maybe your policies were written when you still had kids at home driving. If they're gone, maybe you don't have the right liability coverage. Maybe your car is insured for far more than what it's worth. So really examine that. And then mileage usage. Like I said, if you used to drive, 60, 80, 100 miles a day, and now you're just not driving, maybe there's a discount out there on that. These are all good questions to ask. So folks, hopefully you're, taking some notes down. There might also be affinity discounts. Many of you, because you're police and fire, first responders, so always ask the question, do you have any type of discounts for public employees or first responders? There might be specialty coverages, like say you had a pet that, was covered also, maybe the pet's gone. So, look at your policies and then shop around. But as you're shopping around, make sure you look at the whole picture, because if you do stay with your current company, perhaps they have like renewal discounts or even accident forgiveness, on for a couple of years. So that's a way to save some money, perhaps on your car insurance. When we talk about the home insurance, there's a lot of places right now where it's really hard to get homes insured. If you've been watching the news, between Florida, Kentucky, California, things that's going on there, it's hard to get insurance now for some of those things. The other thing is, look at replacement value. If you had to, what does your policy say? If you had to, take it down to the slab and build up from there, what value is that on? Is it replacement value or the current value of your home? And if anybody's been into a home improvement store lately, a 2x4 isn't $2.50 anymore. It's 3, 4, 5 times that, if you can even find it. So look, pull your policy out and look at, what is the replacement value? Is it what the tax records say, or, is it, more true to that? So contact your insurance agent on that. And remember, with the deductible there, if you have to pay 1% of a $200,000 home, that's $2,000. Is your home really $200,000? So those are things to really look at there, folks. And then, are there separate deductibles if it's a tornado or a fire on top of that? So really, again, get to know your plan. And then, have you had any major renovations? Has that been covered? Is there a bundle discount if you do your home and auto together? And again, shop around and ask those questions. And then when we get into life insurance, when I sit down with folks to do their benefits review, we ask about life insurance, and then, do you still need it? Do you have a term policy, or is it a whole life policy? Are the premiums about to go up? Do you have extra benefits in there, like nursing home riders? Are your premiums going up? Do you want to leave some type of a legacy, or do you just need enough to cover your final expenses? So those are questions that Jim and I ask when we do sit down and do those policy reviews with folks, and really help translate what you have. And then this is the part that I really enjoy. And folks, instead of trying to write all of this down about the in case of death or disaster, I will actually be sending you my little check sheet, my worksheet on, what happens if, I pass away, or there is a flood or a tornado, or, some type of disaster. So a lot of folks I know will get a little, plastic file folder and put their important documents in that. So if there's a fire, they just, pick that up and go. If a wallet is stolen, they've got all the information right there. I have one lady that spends time between Ohio and Florida. She's got, each thing in a little plastic zipper folder, and puts it down in a cooler. So when she's ready to move back to Ohio, she picks up her cooler and goes. Hurricane's coming, she picks up her cooler and goes, which I thought was brilliant. So as we look at the ICOD checklist in case of death or disaster, we've got it organized into about 9 different buckets. And again, folks, I'll be emailing this to you later today. But as we look at this, things to consider, things to gather. The first bucket is life events. Do you have birth certificates, marriage, divorce decrees? I know there's a lot of folks out there that have an extra 2. And then any adoption papers. When we talk about life insurance and retirement, do you have your life insurance policies? Can you lay your hands on them, or did they go when the basement flooded? And we've walked into that situation before. What about your pension documents? Any annuity paperwork, details about the state pension entitlements? And folks, when you're doing this, when you're pulling this stuff together, look at your beneficiaries. Do you have the heir and the spare, and your third child was, I guess they don't care? So, think about that. Make sure that you're looking at your beneficiaries on all your important documents. And when it comes to the pension, review how that was set up. If you pass away, what does your spouse get? And folks, make sure your spouse understands all of this, because day in and day out, Jim and I will sit down with a widow, and she says, my husband took care of all of this. And she just doesn't really know where to start. So make sure that, you know, your family, your loved ones know about this. The third bucket here that we talk about is banking. What are your banking accounts? What banks do you deal with? My grandfather-in-law is 102 years old and he has like 8 different banks that he uses. It's driving my mother-in-law crazy. So make sure that you've gathered all of your account numbers, your passwords, your login information, credit cards that you have, safe deposit boxes. We had one retiree that, you know, his dad passed away and there's a brown envelope with keys for safe deposit boxes. No idea what bank they were to. So he spent his time driving around the city visiting all the banks to see, you know, does this key work in that box? My father-in-law passed away in October of 2020 from COVID, and the safe at his house, only he knew the combination for it. We just found it. His sister had it. So when she passed away, her kids were going through and found the combination to the safe at dad's house. So make sure all of those things are in a good location and your family members know. The next 2 buckets that we talk about is the assets and the liabilities. You know, divide your things into what's making you money and what do you still owe on. So assets, you know, where are your deeds, cemetery deeds, property, land, timeshare ownership, your car titles, any stocks, IRAs, 401ks, any bonds that you have, corporate or cooperative ownership, proof of loans that you've made. When it comes to the liability side, what about your mortgages, your reverse mortgages, proof of your debts that you owe? Get all of that information together because that will help your family members in case of death and certainly help you if there is a disaster. And then monthly expenses. What are your utilities? What types of insurance do you have? Your rent, your mortgage, your loans that you still have. Memberships, you know, membership to PFRO. Any subscriptions, Netflix, Disney Plus, all those types of things. And this is a good way to you know, find money too, that maybe you're paying for subscriptions that you really don't use anymore. So a great time of year to look at that. And then the last 3 buckets that we have here is email and social media. If you were to pass away, would your family know your login information to your digital footprint? So what's your Facebook, your email accounts, your cell phone accounts? Any type of streaming services or computer passwords. And there's little, you know, this is a little book that I've got that I can keep all my passwords together. I had a retired state trooper tell me one time, best thing to do is get a little like 3-ring binder, put all your passwords in it and put it with your cookbooks. Because even if somebody breaks into the house, they don't usually steal your cookbooks. So I thought that was brilliant. The next thing here, contact details. Who's your doctors? What's their contact information? Your pharmacies. Who's your AMBA representative? You know, if the kids come in and say, you know, hey, he's got this cancer plan, who do I need to call? How can they make the claim on that? You know, put the information in there. Who's the lawyer, the minister, the financial advisor, the accountant, or the insurance broker? And then the essential things, your will, your trust documents, powers of attorney. And folks, there is a difference between a financial power of attorney and a medical power of attorney. What's your instruction letter? You know, in case of death or the fact that you can't, you know, make your decisions anymore, what do you want done? And then burial or cremation wishes. And again, folks, we're going to email that out. And, you know, I thought this was kind of timely. I work with a retiree, and she was telling me that mom had fallen and was in a rehab facility a couple weeks ago, and then dad fell and ended up in the same room, rehab facility. And he wasn't doing well the other night. So Jim, in the middle of the night, he couldn't get, the wife woke up because she can't hear and she didn't have her hearing aids in. So he called all the kids in. So in the middle of the night, he had all of his children come into the room. Wife woke up, had no idea what was happening, was scared out of her wits. But that's when dad decided to have the conversation with them that about where his finances were and all of these things that we just went through on a checklist. So when is a good time to have these kind of conversations? Maybe not in the middle of the night.
Now, and I'll tell you, I can't tell you how important this is. I ran nursing homes for years, and it is devastating. And you would be shocked how frequently that happens, to have someone finally, you know, typically our old stubborn men, but hold on to everything so close to the vest that in their dying, hours, they want to share everything about the family, financial situation. And it can be devastating because oftentimes those members don't have their faculties to be able to disseminate the accurate information. So this picture you guys see here, everybody knows I'm kind of an old soul. I'm not big into technology, so I'm not good at creating these PowerPoint presentations. But the gentleman that did for us, this is his mom and his daughter. And at Christmas, mom started asking the same question. Actually, they've been seeing it for a couple months now, but it was really apparent with the entire family together that mom started asking the same questions multiple times during the afternoon and forgetting about things that she was either cooking or focusing on, as far as gifts or just general mundane tasks that were becoming more and more challenging for her. And so his goal for 2023 was to get his mom's finances in order. And we sat down with him and we said, hey, you're doing this. This is your bailiwick. What are the things that we should be asking? And just like Bonnie said, you need to be asking these questions now. If you are 59 to 65 and your parents are in their 80s, you should be asking them these questions. If you're the parent that's in the 80s, you should be sharing this information with someone within your family that you can entrust. So the questions are, where do you keep your financials, or at least your estate planning documents? Your financial advisors, what do you have out there so we can help, navigate the space? Can we meet with your advisors all together? Who are your doctors and medical professionals? What medications are you taking? Where's your pharmacy? A lot of our members are very particular about their specific pharmacy in town, their pharmacist, because they know each other. What planning have you done for long-term care? Think about things, what kind of care do you want when it comes to bathing or dressing or toileting, wiping your backside? I mean, do you want your children doing it, which may take them out of their families and their careers and their livelihood? Or, do you want to spend your life savings and end up on Medicaid or healthcare welfare? Do you want to button up that risk by taking out some level of protection? Do you want to stay at home? Do you want to move closer to family if you're not by family? Would you rather, take your chances and live alone versus be in a retirement community where you have support? These are things that we need to know about our parents, or our kids need to know about us to make sure that the end of life care is appropriate and covered. There's also, big threats to our nest egg. I'm not going to get into these except the last one, which is part of this discussion. But if you think about it, the big threats to nest egg published in USA Today are taking care of elderly parents. The baby boomers are right now caring for their parents, those that are still alive. We're soon going to be taking care of them. If they don't have their ducks in a row, it's going to consume our generation. The death of a spouse without life insurance, it's $12,000 to $15,000 when someone passes in service. If they have outstanding bills, debt, anything else that needs to be taken care of, the family's responsible for that. Boomerang children. This was always, in people's, minds, but since COVID, it has been a catastrophic impact to some of our retirees. They're not only seeing their children back at home because their children's careers were affected, but their grandchildren are moving in as well because they live with their kids. Any medical crisis. We talked about the 4 gaps in Medicare: elder care, cancer, heart, stroke, which I combined into one, medical transport, and then final expenses. Any medical crisis, obviously threat to your nest egg. And then really right now, the thing that we've been focusing on the last 18 to 24 months, overexposure in the stock market as we age. Everybody knows that we've not had the best of years in the stock market. In fact, we've had 13 years on a bull run until the last 18 months. And unfortunately, it is tanked. The market is down 15, average 20% out there. And just to be very direct, once we're retired, especially once we're in our 70s, we just simply can't afford another 2008, where it takes 40% of our nest egg or our value in the market, or, hey, you can stick with it, but it takes 10 years to get those monies back. Once we're in our 70s, we don't have 10 years to get our monies back. And, we want to make sure our members have a plan that if you've got, if you're bleeding out there, that we stop the bleeding. And your police and fire retirees went out along with Ohio retired teachers, school employee retirees. They went out and negotiated a plan that I'll tell you, there's not many things we can get all of the associations to agree on. This is one of them. I'm also invested in it. That's how strongly I believe in it. But, go on to the next one, if you would. The other impact is, I mean, despite the S&P or the Dow finishing down 20% in 2022, inflation is up. We all feel it. Every one of us feel it. Somebody did share with me that the rates right now for a CD are a little bit higher than this. But I mean, if you look at, what you're getting for a 1 or a 5 year CD, it's absolutely ridiculous. And your money's tied up. The association now has an investment vehicle where your money isn't tied up. It has some liquidity. You can put it in the market. And as the market goes up, we realize those gains and participate in those gains. But if the market has any flat downturn, crash, anything negative, our monies freeze at their high water mark. Bonnie, you want to go to the next slide? But it basically assures us that we can't lose any money in the market. And as I go through this, I want you to understand when it's paying out, when the market's doing well, it's doing between 4 and 9%. When the market is doing horribly, which is down 15 to 20% right now, your money's freeze at their high water mark. So I got in February of 2020. I have not lost one dime in the last 2 years, which not a lot of people can say. I'm typically not that conservative, but I saw some writing on the wall and decided I did not want to have my money in the market with the threat of some of the policies that were going to come out. And I couldn't be happier. I can't tout this enough to our members, but it's a tax-deferred asset protection plan. It has no underwriting. So even if you're dealing with health concerns, you're eligible. You can participate in the market gains with no, Bonnie, go back 1 second. I just want to hit these. Thanks. Participate in the market gains with no downside risk. You can use qualified money that you haven't paid taxes on, or non-qualified money that you have paid taxes on. Multiple investment strategies, enhanced liquidity. You can turn it into income if you decide later in life that you want, additional income, including a roll-up feature. But one of the things that we tout about this is it has a long-term care benefit that, God forbid, knock on wood, you deal with an event and you have an elder care plan, but you deal with Alzheimer's or dementia, and your care is longer than the 2-year plan you've set up for yourself or your family. You can use these monies, and the plan will waive any surrender charges or anything. You can use these monies, for that elder care without impacting, again, your family, your estate, for your surviving spouse. But if you're not familiar with this, it is fairly new. Please reach out and ask questions. It's brilliant. I could not be happier. And like I said, I personally put a significant portion of my savings in it, and it's turned out very, very well for me.
And then, Jim, once folks do have retirement accounts or investments, there's some big news coming that way too, isn't there?
There is. Our members, actually, a lot of them call us about their RMDs. And I want you to understand your required minimum distributions are simply how the government gets their share of your money. You put it away. They want you to start pulling that out at age 71, 72, 73, so they can tax that and get their portion of your monies. Now, the monies that are taxed, or the monies that are eligible for taxing under RMDs, include your rollover IRAs or individual retirement accounts, your SEP individual retirement accounts, your traditional individual retirement accounts, and then state employees, teachers, 403Bs, your general market 401ks, your 457 accounts. Those are all considered in your assets, if you will, that are taxable under the RMD umbrella. Things that are not are your Roth IRAs, things you've already paid taxes on, your pension money that's coming in, or any CDs or money market accounts, money you've got in the bank. You've already paid taxes on those. Those do not apply. So what and when do we pay our required minimum distributions? This was another big deal for 2023. So what are they? They're a portion of your account or your savings based on your age. The amount grows each year as you age. So somebody that's 85 is going to be asked to take out a little bit more than somebody that's 72 or 73. And it's based on your account balance from the prior fiscal year. So when do you take it out? If you are 74 or older right now, you would have started taking out your RMDs prior to 2020 at age 70 and a half. And then COVID hit. And they decided, hey, our people don't have as much money in their pocket. The entire economy's been impacted. We're going to bump this up 18 months people aren't going to be required to do their RMDs or start them until 72. Well, obviously, COVID's continued. Part of the Secure 2.0 Act, which we've talked about earlier, it is actually got, as of January this year, anyone, that's 70, 71, 72, don't need to pay their RMDs until age 73. And then just a little bit of heads up, over the next, I think, 6-7 years, between now and 2030, it's going to increase to both 74 and ultimately age 75 before you're required to take out your RMDs. But you're required to take them out, the first one by April 1st. If you have any questions, like I said, please feel free to ask Bonnie or myself. And don't forget, another big deal that works in our favor, but it's still negative, is the tax penalty. Until January 1st, it was 50%. So if you owed, if your RMDs were $4,000 and you missed that date or didn't pay them, you owe the government $2,000 plus your RMDs. They penalize you by 50%. Now today it's 25%. That's still $1,000 for a $4,000 RMD. So make sure that you've got your ducks in a row and you're prepared for that. You can determine where you take your, individual retirement account RMDs from. If you have a fund that's performing incredibly well, not a lot of them right now, but if you have one, you might not want to take it out of that fund. You may want to take it out of one that's not performing so well. Do you want your payments automated? Do you want them monthly, annually? Do you want to take taxes out or not? Don't always rely on your fund manager, your tax guy, your financial advisor to do your RMDs, despite the fact most will remind you and make sure that you're aware of them. It is on you. We are individual responsible. And if you don't have to take cash. Actually, I like to end with that one. If you've got a much younger spouse, some of our folks have remarried. There is a provision there where you can save about 20% on your RMDs. And then also, you don't have to take out cash. We do have some retirees that are in strong financial situations, and they don't need that $3,000 or $4,000 that they need to take out. So what are the options that you can do with that? The next slide shows us that you can, first of all, button up your long-term care risk. If you have not talked about elder care for when you deal with an event and you need a year or two of rehab or facility care until you're back independent, brilliant way to spend your RMDs. You're forced to take them out. It's not in your budget, doesn't impact your budget. Button up your elder care risk. Look for a life insurance policy for either final expense, that $10,000 to $15,000 final expense, or a life insurance policy to fund an inheritance. A whole life plan or something a little bit larger that you can leave to your family. Convert the Roth. Oh, this is brilliant. You can convert to a Roth IRA and pay the taxes in 2023. And there are some big changes coming in 2024. But if you convert your money to a Roth IRA and pay the taxes in 2023, you will never pay taxes on that Roth IRA again, ever. And I don't understand all the details. I was told that as we were preparing for this, and I need to get into them. But by the time anybody talks with Bonnie and I, we will have the information. Reinvest in a non-tax qualified plan. Fund a 529 college plan for your grandkids, or make a charitable qualified contribution, whether it's to your church, whether it's to a school, a local organization, whatever your charitable foundation is. It's a brilliant way to spend those monies, if not preparing for your long term.
And Jim, we're doing all of this for financial wellness and doing these reviews, and hopefully, folks are getting good nuggets of information. But at the end of the day, I imagine the most of the folks are on here is because, 58% of us are actually worried about outliving our money. So, hopefully the tips and things that we've provided today can help stretch that. And this is just sort of a fun fact thing, but as we look at this, and you look at the number of folks that in 1965 that were 65 versus the number of folks that were 65 in 2015, that's what this chart is showing. And as we look at folks living into age 70, living into age 80, and even living into age 90, ladies, a third of us are going to live into our 90s. So, what is the financial impact of that? How is inflation and life changes and those cancer diagnoses? It's great, that cancer has made a lot of advancements, but medication costs a lot, or, the elder care. costs a lot. What is that going to do to affect us? What about the home care, recovery time after the hospital stay? Especially as we get older. So are we prepared? So hopefully we've given you some tips today to get your financial wellness into shape. One of the last things that I wanted to touch on was the myambadiscounts.com. Like I said, we did this program in December for our members. But remember, because you are a member of the Police and Fire Retirees, and take advantage of AMBA, you do have access to thousands of discounts through the myambadiscounts.com. Everything from GNC Wellness to active fit programs, tax savings, trusts and wills, the online savings with Calm to after you think about all these finances, maybe you need a little calming. And then they also have discounts on major appliance purchases through Whirlpool. They also have discounts for dining out or meal prep or giving gifts, and even travel if you just need to get away to get all this get that relaxation. So again, leverage your membership and hit that myambadiscounts.com. And Jim and I can also help you get everything set up. There's a phone app, and you can also go onto the computer. We've had folks save $800 on hotels, or I personally saved about $100 on a new printer for my home office here. So make sure you're utilizing your benefits. And folks, when we started today, we said that we were going to cover a lot of information, and hopefully we lived up to that promise. But there's many changes every year, just like we said earlier. So it's really important that you do a financial checkup, do a benefits review, and you can schedule that either by taking out your phone, putting it in camera mode, and hovering over the QR code there. Or you can contact Jim or myself. Our phone numbers are listed there, as well as our emails. So if you're not a techie person and don't want to do the QR code, you can always just pick up the phone and call us or send us an email about what you're interested in or what you have questions about. So we've gone over an hour, and I do apologize about that, but we did want to make sure that we got all of the information covered. It was a lot today. Just a couple reminders. I will be sending out that in case of death or disaster check sheet to everyone later today. And our February Teaching Tuesday on the 21st at 11 a.m. will be on Medicare 101. So I strongly encourage you, if you have friends or folks that you used to work with that have not joined one of these, please make sure that you let them know about it. Missy's great about sending the announcements out, but obviously there's a lot of changes and a lot of things to consider, and especially with the PFRO stipend, or I'm sorry, the OPNF stipend, we want to make sure that no one is missing out on anything. So folks, with that, I bid you a great day and stay healthy, and we'll see everyone next month. Thank you.